Pregnancy-related mortality is when a mother dies during pregnancy, delivery, or within 1 year postpartum. In Missouri, that rate is 4 times higher for Black women compared to white women and 2.5 times higher nationally. This week, we're talking about the maternal mortality risk for women of color. I'm here today with Dr. Ingenue Cobbinah, OB-GYN at St. Luke's Health System. Thank you so much for joining us.
Thank you for having me. Appreciate it.
Well, Dr. Cobbinah, why is this risk so much higher for minority women?
So for minority women, healthcare, maternity healthcare is a part of healthcare. And as you may already know, healthcare in general in the United States, for minorities, our mortalities and our outcomes tend to be worse. So maternity care is no different. In terms of when we're seeking care, there could be issues with bias, just not lack of recognition of the issues that are specific to African American women or other patients of color. So that kind of all interrelates, and anything that we can do to improve relationships could probably improve that mortality.
Right. So what kind of factors contribute to this disproportionate risk?
I think the first thing is just a lack of communication or understanding from the two parties, provider side as well as patient side. There's opportunities for providers to get additional education about what the risk factors are for persons of color and educating their patients about what their risk factors are. I think once we take those opportunities, we can improve outcomes for the patients in that regard.
Now, in Missouri, Black women are 4 times as likely as white women to die within 1 year postpartum. Tell me why the role of postpartum care is so important in a woman's pregnancy.
So ACOG recently came out and specifically addressing the fact that sometimes patients are not following up for postpartum care. One of the things that we want to focus on a lot is hypertension, because we are seeing more incidents of postpartum hypertension. And if we have the opportunities to actually to have patients come in a couple of days after their discharge, we have an opportunity to intervene and prevent complications that you can see with that. Again, one of the other complications that you can see is cardiomyopathy, and that too can happen in the first couple of weeks after delivery. So, and patients may not understand the importance of the postpartum visit. They get it in their head that, once the baby's out, everything is out good, and that's actually not always the case. That's actually some of the more complicated things that can happen tend to happen in the postpartum period.
So what should women, especially minority women, know when searching for their OB provider?
Well, in Kansas City metro area, unfortunately, there's not a lot of persons of color. And the reason why I mention that is because we know that when persons of color seek maternity care from persons of color, their outcomes tend to be better. With that, with the numbers being relatively low, it means that the patients have to seek care from providers that are not of color. So I think the most important thing that those patients can do is actually have that conversation with their provider when they're seeking out the provider. Find out if they are aware of what their risks are. Are they comfortable with having that conversation? Because if they are comfortable with having that conversation, that's probably going to be a good provider for them.
So what does St. Luke's do to provide the best care for these minority patients? So
I think it's really important that we are aware that we are having those conversations on a regular basis. I know within my practice, our providers and our nurses and our front staff, we have conversations about what it's like to take care of patients of color. We are making an effort to make sure we're aware of the biases that we can sometimes display that impact patients of color.
Well, is there anything else you'd like to add?
Actually, there is. I think it's really important that we understand that within the minority community, it really doesn't matter what your socioeconomic status is, your education level, you're at risk. I personally myself, even though I'm a physician and do relatively well, that I myself had a complication when I had my delivery 18 years ago. So I think we're not you're not safe just because you're educated. Being a person of color puts you at risk, and I think that's why it's important that you choose the right provider when it comes.
Well, thank you so much for joining us today.
Thank you.
If you'd like to find out more or find a provider, visit stluxkc.org/maternity. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stluxkc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.